This is my sheep heart. I think it came from a sheep that was at least 55 years old before it died, and then they left the heart sitting itself for another 25 years before they donated it to science to help us learn about anatomy. It was very tough to cut into, but I tried my best. Okay, so we shall start with naming our external anatomy. The visceral pericardium is the outer covering of the muscle. The apex is towards the bottom. I have my right and left atria. The right atria is on this side, the left atria is on that side. The right atrium carries deoxygenated blood, and the left atrium carries oxygenated blood. I have my right and left auricles. My left auricle is right here. And if I flip this around on the back side, my right auricle is over here. The auricles are used to help increase atrial volume. If I flip my heart back to the anterior side, I can show you the intraventricular sulcus. This area right in the middle here, you kind of can see like a little creased dent like structure. Okay, I have the pulmonary trunk. I'm going to show you where that is. The pulmonary trunk towards the top. It's kind of hard to see all these at the top because of how my sheep heart was separated from my poor little sheep. Okay, so the pulmonary trunk is at the top, and this area helps carry blood to the lungs, which is deoxygenated blood. Okay, now I have my aorta, which is also at the top. The aorta carries blood to the body, and that blood that gets carried to the body is oxygenated blood. I have my ascending aorta. Turn this to the back like so. My ascending aorta. My aortic arch. And at the top, which will be hard to identify, are the brachiocephalic artery, the common carotid, and the left subclavian. But like I said, these are hard to distinguish because of the way my sheep was separated from its body, and it's just so sad. Also, I can show you on the posterior side, the superior vena cava, the inferior vena cava, and the coronary sinus, which are hard to distinguish. They kind of look all smooshed together, and I don't know, it feels kind of squishy, but they're all kind of squished together. It's hard to distinguish. You can't really pull them up without breaking the whole thing apart. Okay, with the coronary sinus, it helps carry blood to the right atrium, and this is the external surface of my sheep heart. I'm going to try and show you the best that I can of my internal anatomy. It's kind of hard to do this with one hand, but I'll try my best. It was hard to cut into, but as you can see, I have my right and left side. You can kind of look in there. We can see some chordae tendineae. Inside us also contains the papillary muscle, the pulmonary semilunar valve, and the aortic semilunar valve. I have the tricuspid valve, which is also known as the right atrioventricular valve, and I have the bicuspid valve, also known as the mitral valve or left aortal ventricular valve. I have the trabecular carne on the inner surface of my ventricles, and the myocardium of the right and left ventricles. It's very hard to just hold on to. The myocardium of the left ventricle is 3 times thicker than the right ventricle because the left ventricle pumps all that blood into our bodies to keep us alive. This is my sheep heart. Very hard to see, but I did it. Have a good night.